My name is Stephen Ruggles, and today it is my honor to introduce our fearless leader, John Robert Warren, also known as Rob Warren. He is our keynote speaker for today, and he will be talking about linking. In 2002, when Rob showed up in Minnesota as an assistant professor, we had a little fledgling population center, but the problem was that we only had a handful of demographers, and in fact, they were concentrated in the history department. But thanks mainly to Rob's effort, that situation has changed dramatically, and Minnesota is now recognized as a powerhouse of population research. And we've got strengths across a wide range of fields, especially sociology, public health, public affairs, applied economics, geography, as well as still in history. So Rob used a bunch of strategies to do this kind of institutional development, and one of them was he chaired got the provost to agree to fund a bunch of new positions, and then chaired this cluster hire that ended up hiring half a dozen demographers across a whole bunch of departments, and that had a transformative impact. So he's built a luminous career over the last 22 years at the University of Minnesota. He's director of the Institute for Social Research and Data Innovation, ISRD. ISRD is the entity that houses our Minnesota Population Center, the Life Course Center, IPUMS, and the Minnesota Research Data Center. And Rob is a past director of the Minnesota Population Center, and he played a key role in the development of both the Life Course Center and of IPUMS. He founded the Population Studies Training Program in 2010, and then he founded in 2018 the Population Health Sciences PhD and postdoc training program that's supported by an NIH training grant. He's a prodigious fundraiser. He currently ranks third among all University of Minnesota faculty in external research funding. One of those projects, EdShare, is a longitudinal data infrastructure, which I think is poised to become one of the leading sources for cognitive health research in the coming decades. For all of this institution building, what Rob is really known for is his inventive scholarship. His work on health, aging, education, and work across the life course has had huge scope and creativity. He's conducted path-breaking research on how social contexts and environmental factors affect a whole range of individual level outcomes over the life course. His research on education has been truly transformative, and he's examined everything from the impact of facial attractiveness to lead exposure to naming patterns on life chances. And this work has profound implications for both basic scientific understanding, but also the development of effective policy. So a lot of Rob's work depends on methodological innovations that he's made in survey research. And maybe among the most important of these is his work with linked data. And this includes everything from linking data from month to month in the current population survey to linking censuses to surveys of aging taken decades later, but also linking families across multiple generations. So today, Rob is going to talk about data linkage in his presentation, The Promise and Perils of Linked Data, Where We Are and Where We May Be Headed. So please join me in welcoming Rob Warren.
Can't possibly live up to it. Thank you, Steve. Thank you all. For God's sake, please keep eating while I talk. We have a lot of food. I worked with Kari and Amy to come up with the title for this talk, and I made it as general as possible so that I could talk about anything I wanted to when the time came. So we'll see how that turns out. I should start by saying, please join me in thanking Kari and Amy and all the other people who put these amazing amount of work and time and thoughtfulness into constructing this conference. Okay, the promise and perils of linked data, where we are and where we may be headed. I want to start by saying who we is. Many of you are data users. You use linked data, but I have news for you. You are going to become data producers. And some of the more senior of us are probably mostly people who make data for others to use. But so when I say we, I'm really talking to both groups because the younger crowd will eventually become the older crowd that's making linked data for everyone to use. And I want to start my talk by talking entirely about myself. And what I'm going to present, I'm calling a life in data footprints. And this is all the ways that I can think of, and I've actually thought of more since I made the slides, in which I show up in data across my life. So here I am before I went to school. Definitely had a birth certificate, social security number. Right after I was born in 1969, the 1970 census enumerated my family, my household, and all the information that goes into the decennial census. Of course, my birth certificate had my weight, information about my parents, and all kinds of stuff that I can't remember, probably my exact street address. The census certainly had all of that, not my birth weight. Multiple ways now you know who my parents are. They got a divorce, so they showed up in divorce records as well. There were probably random surveys of early childhood that I participated in. You know, probably my parents did, but answering questions about me. And of course, all along the way, I'm showing up everywhere in medical records, from birth through every well child visit, through that time I fell off the slide and bit my tongue, through lab tests and pharmacy records. I also showed up in all kinds of housing records, phone books, maybe utility bills, I don't know. Then I go to school, starting at about age 6. And now I have all kinds of other records. I have report cards. I have whatever they keep track of in school records beyond report cards. Probably other random surveys at various times. Transcripts. The 1980 census, the 1980 census rolls around. Later in school, I start to have things like SAT scores, and I get my driver's license. So now the Department of Motor Vehicles knows about me and where I live and what kind of car I drive, and he's got to register my car. Perhaps I show up in criminal records, and all that goes into that. And of course, all along, I'm still acquiring information in medical and housing records. I'm in the yearbook multiple times, probably. Yearbooks are a wealth of information about young people, who they hang out with, about their school, the resources within their schools, and so forth. So I'm leaving quite a digital footprint, and I'm just out of high school. After high school, a lot of the same things continue. I won't bore you with all the details. I move around. So I'm in multiple DMVs. The 90 census comes around, more surveys, graduate from college. There's a marriage record. And in addition to medical and housing records, now I'm showing up for real in financial records on my own. IRS, Social Security, banks, credit agencies know about me, and they know a hell of a lot about me. I get a little older. Well, kind of a lot older. I show up in the American Community Survey, multiple censuses, passport records, TSA, divorce records, more marriage records. Later on, of course, technology. So Google knows everything about me. That's a map of one day of my movement around the Twin Cities when I started this talk. Strava knows all about my heart rate and sleep and everything else. I've left quite a digital footprint so far, and I'm not done, of course. I don't have death records yet. So the dream, I think, maybe it's a dream, is to have all of that information linked and available to us. Not just for me, of course, I'm not that interesting, but for huge swaths of the American population, for representative samples at least, but hopefully for everybody. That I think is, in some ways, the dream, because then we can study almost anything that you can imagine across any kind of discipline. So what I want to talk about today is more about that dream. And that dream, if it sounds rainbows and butterflies, it kind of is, although it would be rainbows and butterflies with zeros and ones because it's data. So how close are we to that reality? In summary, what I'm going to say is, how close are we to having data on everything we'd want to know about somebody from every digital footprint that they leave, and for lots and lots of somebody, so that we can study trends over time and space and social groups and so forth. I would say right now we're at about a model A on the scale from riding a horse to driving a Tesla. Now, a Model A isn't bad. It followed the Model T, and the Model A has all the stuff that a car is supposed to have. It has four wheels and I mean, it looks like a modern car. Engines in the front, steering, suspension. I don't think it had a radio. So it's not bad. This is not a criticism. It's a far removed from riding a horse. Let me give you some. I'm going to start out with self-serving examples of the progress that we've made from the horse toward the Tesla. The first, and those of you who were here yesterday have heard about this. Some of you may already know about the IPUMS Multi-Generational Longitudinal Panel, MLP. MLP is, am I on this slide? MLP is a collection of, initially, we just linked all the censuses. Let's just link all the public censuses, 1850 to, at that time, 1940. We've been refunded to add 1950, to plug it into the CLIP architecture through 2020, which plugs it into the ACS and the CPS and Social Security records. I have a project that some of you may have heard about yesterday to link initially 1940 to a whole bunch of modern aging surveys. That's all plugged into MLP. We have funding to add linkages. Well, we've linked to military records. I have funding to link to electronic health, cohort from electronic health records. That's pretty cool. That's not everything. It's not everything that we might want to know about somebody in order to be able to study everything. And this is the largest, I think, Steve has told me, the largest longitudinal population database in the world. It's incredible. I tell people about it and I watch their facial expression change. But it's not everything that we'd want to know about people in order to study everything. It's not capturing their entire digital footprint. A second self-serving example, Steve mentioned EdShare, Education Studies for Healthy Aging Research. Here's the gist of it. And by the way, there's an MLP poster this afternoon. Come learn more. There's also an EdShare poster this afternoon. Come learn more. EdShare is a collection of two cohort studies, both started as education cohort studies fielded by the US Department of Education. Every decade or so, they draw a random sample of tens of thousands of American high school students, and they interview the hell out of them. They interview them every couple of years. They interview their teachers and parents and school administrators. They collect transcripts, high school and college. It's an incredibly intense period of data collection of both administrative records and surveys. We know everything about these kids. But because it's the Department of Education, they're then done with them. Age 25 or 30, see ya, it's over. We repurposed both cohorts as aging studies. We went back at midlife, recontacted them, followed them forward. So now we have surveys at midlife, but also measures of cognitive functioning, health. We have blood, saliva, MRIs. and all kinds of administrative records, including things like the last 7 years of pharmacy records and the last 20 years of consumer credit records. That's pretty incredible. It's not everything. It's not everything that we'd want to know about these people. We are constantly coming up against, we can't do that because we don't have measures of X, Y, or Z. So a Model A, that's pretty good. I'll take a Model A over a horse if I'm going across country, but we're not yet at the Tesla. Some other examples that are somewhat less self-serving. And I'm going to steal here from some of the talks this morning. Dustin gave a great talk on the economic consequences of lead exposure. You all know, and Dustin explained, lead's really bad for you. It comes from multiple sources, especially earlier in the 20th century. There's been recent work that I was involved with, but not really the lead of. In this case, linking data from the Wisconsin longitudinal study that you may have heard about yesterday to data on the proximity of lead mines in southwestern Wisconsin. So this is a weird linkage of data, but it allowed us to understand the effects of proximity to a lead mine on cognition. And there was one. Living within 10 kilometers of a lead mine resulted in worse cognition many decades later. In work that's somewhat parallel to what Dustin talked about this morning, we published work on the effects of water-based lead on cognitive functioning in the Health and Retirement Survey. It turns out it doesn't really affect how quickly you decline. It just affects the intercept of where you start when you decline, which means you get to a problematic point more quickly. These are all examples of progress. These are things you couldn't have done 10 years ago, 20 years ago. Another example of something, this one actually hasn't even been done. This is a redlining map of Seattle. Redlining, of course, was the racist practice of allocating home loan opportunities based on primarily the racial composition of neighborhoods. There's tons of work now on the effects of redlining on people's life outcomes. Almost all, possibly all of that work uses, the exposure is living now in a neighborhood that used to be redlined. But if you think about like, what are the pathways through which living in a redline neighborhood affects your health or your income or your happiness or whatever, it's about childhood, when the neighborhoods were actually redlined, when you actually couldn't live in particular neighborhoods. So for the first time, I think, Samantha Friedman at SUNY Albany, University of Albany, is what they call it now, is linking maps from that period to the 1940 census, to various outcome data, to really, for the first time, understand the effects of actually growing up in a redline neighborhood on how your life turns out, which is progress, incredible progress. I would shout out the work by way of progress of Evan Roberts, who I know is here, along with colleagues Sepp Modric and David Rakoff, who took, I think it's just 2 items from the 1940 census, which asked about families or individuals' participation in New Deal era work projects. And then extrapolated from that, how much New Deal investment in these programs is there around here, around where people lived, and found linking to the Wisconsin longitudinal survey. So keep track of this. This is census data linked to information about the WPA programs, linked to WLS data, to understand the consequence of local investment in New Deal era programs on how kids' lives turned out with respect to things like IQ scores, and found substantial effects. Really interesting. Couldn't have been done 10 years ago. Work led by some folks in the room, but others, Jonas Helgerts, who many of you know, and Elaine Hernandez, who some of you know, are doing work on the 1918 influenza pandemic, which has been studied to death. There's hundreds and hundreds, thousands of papers on this. Few of them have taken advantage of the fact that the impact of the flu, or the severity of the flu, differed tremendously from city to city, and the timing of it also varied tremendously. So taking that information about how bad the flu was in each city and when it affected people, linking that to the 1910 and 1920 censuses, which they then linked together, you can study the impact of having your mom be exposed to the flu at particular points in your 9 months of gestation and how that shapes your risk of being born at all. They find that there's a culling effect, that if you were exposed in utero, the inference is that weaker fetuses were lost. But then conversely, that then has the effect of producing a cohort of babies that are more robust and are more likely to survive to the next census. But that's only possible by taking households and linking them across censuses and then linking this to information about the timing of the flu, which is amazing. And again, couldn't have been done 10 years ago. Another example, this is work coming out of the Fed on dementia. And the intuition, and so this is work that links Medicare data to Experian credit report data, which is a pretty creative blend. And what it's showing, so I'll orient you here. 0, the middle point, is the month, it's the point at which Medicare recipients were diagnosed with dementia. The x-axis in the top, the x-axis in both is how far you are from that diagnosis. On the top, the y-axis is changing your credit score. And their point is that your credit score starts to go to hell before you're diagnosed, before you know you have dementia, often many months, years before. On the bottom is delinquency, which I believe is, are you behind on your bills and your credit cards? It's evidence that in the inference, and I don't know if I buy it, but it's really cool use of linked data, is that you can foretell somebody's cognition is really in trouble long before they're diagnosed, just from how they're dealing with their finances. Amazing. I think the last example from the Wisconsin longitudinal study, this is a paper linking yearbook photographs to the survey data and then mortality data. Among other outcomes, showing that there's a relationship between how attractive people are rated to be and their mortality. There's a whole, it's not causal, there's a whole story behind it. We can talk about it later. But again, it's a creative use of data to answer questions that you couldn't possibly have answered before. It's not the last example because I stole some from this morning. I like the BYU paper, particularly because that's a really powerful figure of results. Something that I've not seen before. And it's, again, if you were not there, linking census full count data, the collection of family search data, and more. It's really a powerful use of linked data. I'm not giving away the results of a talk this afternoon, but I did steal some slides. This is a paper that you're going to hear, and I want you all to stay and listen to, about the effects of a giant wildfire in 1910 in northern Idaho and western Montana that linked spatial data on that fire to death records to full count census data to understand what the effect of breathing in the smoke from the fire was on mortality and later life socioeconomic outcomes. That's incredible, and that's creative, and it's germane. 1910, that's a long time ago. Well, we have wildfires in northern Idaho now. And I don't know why that smoke would be any less relevant than the smoke 100 years ago. Progress. This is incredible progress. Things that this room is doing that really couldn't have been done before. And now I have to take a little aside. This paper reminds me of a paper that I want somebody to write. So junior scholars or dissertators, somebody. This is a map of the fallout from the Trinity nuclear test. It's the only above ground nuclear test in the US, in the continental US, between 1940 and 1950. We know exactly how much radiation fell, exactly where, including on places like Las Vegas and Santa Fe. One could link 1940 to 1950 to death records and use spatial information about the fallout to understand the effects of the nuclear test on child mortality, adult mortality, socioeconomic outcomes. I don't have time to do it, but I hope somebody in the room will steal this idea and acknowledge me. So how close are we? There's an amazing proliferation, even in this room, of imaginative and important research projects that that use the kinds of data that we at ISRD and IPUMS use all the time, but also all kinds of other contextual information drawn from all kinds of sources, from all kinds of fields. But we often make big compromises in measurement. This is one of the reasons we're not yet at the Tesla stage. I'm not going to pick on any papers. I'm only going to pick on papers where I've made the same or am guilty of the same weakness. So earlier we heard a paper using the PSID and the 88 measure, which many people, including me and other contexts, have called a measure of dementia. It's not. It's a measure of memory complaints. Raise your hand if you have trouble figuring out new gadgets, electronic gadgets. According to this measure, you have dementia. How many people have trouble remembering appointments? So you now have 2 out of 8. You have relatively moderate dementia on that scale. But it's the best you can do, right? It's a compromise. That's what we have. Another I would pick on the work that we heard on lead exposure. And again, I've published using this measure. It's really interesting to study the effects of lead exposure on all kinds of outcomes using water data, where you know the composition of the service lines and the pH of the water and something about the hardness of the water, and you can infer who was exposed. That's great. That's not even the main source of lead exposure in those eras. It was airborne lead from burning gasoline and also eating paint and other sources. That's the best we can do historically. It's a compromise, and it's a potentially very limiting compromise. Doesn't mean it's not amazing. It just means we're not yet at the Tesla stage. I think we're at about the Model A stage. I would also say this field is sometimes guilty of the old aphorism of looking for your wallet under the lamppost. You know, the guy's searching around under a lamppost for his wallet, and somebody comes along and says, "Did you lose it around here?" "No, I lost it down the street, but the light's really good here." Right? We do that a little bit. Why, for example, are we looking at lead exposure and economic outcomes in the early 20th century? Because we have the data. The generation that was most exposed to lead in childhood is just now reaching the age of dementia and later life health problems. They were exposed in the 1950s and 60s, and that's because that was the era when people started driving a lot all around the country with leaded gasoline. But we do that research in a historical area where the light is good. That's not a criticism of the work. It's still important work. But it's progress, but we're not quite there yet. So Model A, not a horse, but also not a Tesla. So how can we make progress? I'm going to be less verbose here. You'll be glad to know. One is that we got to preserve the data and archive the data. And there are, yes, I thought you were going to clap. We got to preserve and archive the data. When the data are gone, the data are gone. Earlier, when I gave my lifetime footprint, it reminds me of a story. I recently called a hospital that I know I visited when I was a kid because I had a question about the health condition that put me in the hospital. And their answer was, "Oh, we threw those away like 20 years ago. It's gone. It's gone. It's never coming back," right? I'm also reminded of the 1921 fire that destroyed almost all of the 1890 census. It's over. You will never link the 1890 census to the 1880 or 1900 census. Evan Roberts educated me about a massive data collection operation toward the end of World War I. In the US, the federal government, the Children's Health Bureau or something like that, weighed and measured 2 million American babies. That's got to be damn near all the babies. Certainly almost all the babies living in cities. And it includes those physical assessments, but it also includes the parents' names and addresses, which you can easily link to the 1920 census. All the data are gone, as far as we can tell, except for St. Paul, Minnesota. Evan? Where's Evan? He's gone. That's a hellacious loss of information. Imagine what you could do with those data if you had the whole country. I would also shout out the work of IPUMS International. There are many, as I understand it, countries around the world where their census and other kinds of data would be lost if it weren't for the people in this room. So we've got to preserve and archive the data. We've also got to digitize the data. It's not very useful when it's in paper sitting on a shelf. You can go on classmates.com for free or ancestry.com for a small fee and get virtually every yearbook, high school yearbook, many college yearbooks. As I said before, yearbooks are a wealth of information. You have people's photographs, first of all, which you can code, there are well-developed methodologies for coding things like attractiveness and skin tone and adiposity and socioeconomic conditions. But of course, you also know tons about the school. Do they have a physics club? Do they have a debate team? Are the academic clubs all segregated? Are there any Black teachers? And on and on and on. You can learn a ton from yearbooks. As far as I know, none of them are digitized. You can look at the photographs, but you can't do much with that unless you invest a ton in digitization. The same, I think, is true for phone books. How many of you have ever physically held a phone book? All right, we still got some old timers. This is a phone book, kids. Phone books had your phone number, of course, but it also had your name. And if there were multiple people living in the household, they would be listed on the same line. That's data. It also generally had your address. Imagine if you had all the phone books from, say, 1960. That would be an incredible data resource. Do they exist somewhere? I don't know, probably. But without archiving, preserving, digitizing, they're kind of useless to us. One marker of I guess, a win is under the leadership of Steve and other people on the IPUMS project, we have digitized the decennial censuses, which was an incredible effort. So that's a win. So those are areas where progress, I think, is necessary. Other common barriers to progress, and here I'm not so much talking about the people in the room. I'm talking about all the rest of academic and other kinds of researchers who use data of the sort that we use, but are not record linkage people. The first one is imagination. So often I talk to people and I describe my own work or somebody else's work who's using linked records, and a look comes over their face like, wait, what? You can link those? That's a thing. And that fundamentally constrains how we are all very imaginative people. We do imaginative research. But if you don't know what's possible, because you don't know that this can be linked to that, you can't imagine new research. So we need to be imaginative. We need to not assume that it's impossible to study something because there's no data for that. Without that imagination, we will not think of new creative linking projects that will, in fact, be possible. Another barrier is that creating new linked data is incredibly resource intensive. Anybody who's ever been involved in this knows this. It's not a clean data file where you go into Stata and merge on the ID variable, right? You have handwritten names here, and over here you have digitized names, except for it's just initials and they're spelled different. Go, link, right? Or you have addresses, or this is an incredibly messy process that takes lots of time and money. And part of another reason why it takes time and money is because of institutional gatekeepers. Many forms of data aren't just ready for you to go pick them up, right? If you want IRS data, you should build in a couple of years or more to get access. If you want to go to the Minneapolis Public Schools and get information about student level test scores with identifiers so that you can link it to some other resource, might be possible, but it's going to take you years and a lot of time and money and meetings. These are things that are barriers to progress, particularly for earlier career scholars who tend to be more energetic and more imaginative about these things. So it's kind of on us older folks to do that work. So how can we make progress? Preserve and archive old data, digitize, be creative and open-minded about what's possible. Catch yourself saying, we probably can't study that because there's no data. Perhaps by combining data, there is a way to do that. Know going in that this is expensive and time-consuming. And I'm going to say more about this. Partner with institutional gatekeepers. I'm going to come back to this in a second. Last question. Is progress unequivocally good? Is it always good to be continuously moving toward the Tesla where we have all the data we would ever want on anybody ever? There's a balancing act here. So on one hand, of course, we want all the data for anybody anywhere because that allows us to study anything that we think is important. There is so much good science to be done with linked data. On the other hand, many people would look at it differently. You mean you have everything about me ever? on a hard drive somewhere, linked together. That's terrifying, right? Who has access to it? What are you going to do with it? We also know that data breaches and hackers are real. Security issues are real. There was an article in the Washington Post this morning encouraging people to protect their data. Don't give it up to sources that probably have legitimate reason for wanting to use your data. The problem here is that there is a risk. We want to use the data. We want all the data. We want all the data linked. We want all the data for everybody. The problem is that those who own the data, either because it's their data or they're an institution that controls the data, will put up a stop sign and say, I don't know you. I don't know what you're doing. I don't trust you. Stop. And now we have another barrier that we have to overcome. So there's a balancing act here. How do we balance the benefits and risks of record linkage? We all can enumerate the benefits. We've heard great talks. We'll hear more talks about the benefits. How do we balance that against the risks or the perceived risks that people who own the data might have? I'll start with one example. This situation about the risks and benefits of linked data reminds me of another situation coming out of a conference. I was just at a conference in Alzheimer's disease. This is an issue that people talk a lot about. This is a demographic by race composition of America in some recent year. I stole this figure from the conference. I forgot to write down what year. It's recent. That's America. This is the racial composition of people who do clinical trials in Alzheimer's disease. It's almost all white. And if we could break it down by gender, it's almost all white women. And if we could break it down by SES, it's almost all college-educated white women. Why don't people do clinical trials, particularly people of color, but particularly people underrepresented in research? The main reason is mistrust. I don't know you. What are you going to use my data for? Another is a lack of awareness. I didn't even know there's a clinical trial. And I certainly don't know how it might benefit me or why would I want to do this? There's a lack of information. And by that, I mean wrong information. I hear going into that MRI machine will give me cancer. I hear that it hurts. There's a lack of comfort with the process. So as a person of color, you want me to drive to Johns Hopkins University, no offense, Johns Hopkins people, I grew up in Maryland, to a predominantly white space to subject myself to this machine that I don't understand, and I don't know what you're going to do with the data. And then there's also very real time and resource constraints. You want me to come at 3 o'clock on a Thursday? I got to work. Who's going to take care of my kid? I got to drive how far? Where am I going to park? These are seriously the things that stop people, that research evidence shows, stop people, particularly people of color, particularly under-resourced people, from participating in clinical trials. Why don't people agree to link their records? And here I mean the individuals. You come to me, we do this in EdShare. Thank you for answering all those survey questions. We'd now like your consent to get the last 7 years of your pharmacy records. Sign this, and we'll know every drug you've taken, the dosage, the inferred reason that you're taking it, the name of the pharmacy that prescribed it, the name of the doctor that prescribed it, and the exact dates, and whether you filled the prescription. Here you go. Why don't they say yes? Same answers. Who the hell are you? What are you going to do with my data? I don't trust you. I have no idea why that would be of benefit to me or to the world. I'm really uncomfortable with the process. Are you going to talk to my doctor? Are you going to talk to my pharmacist? I'm not comfortable with that. Why don't organizations who control other people's data agree to let you link? Here I'm thinking about, it could be the Census Bureau, it could be credit agencies, it could be the Social Security Administration, it could be the Minneapolis School District. Same answers. I don't know who you are. I am charged either legally or at least in other ways with protecting these data, and I don't know who you are. I don't know what you're going to do with these data. I'm not comfortable with this process, and you're telling me it's going to take how much time for my staff to do it? I don't have those resources. It's very much the same thing. So how do we get around that? I would argue the first thing is to not think in terms of data extraction, but to think in terms of long-term partnerships. This is how successful places that get people to do clinical trials do it. we build relationships in the community. If I run an MRI center and I want to get a diverse group of people to come to my MRI center so I can do brain scans for real science, I spend years in the community. I host picnics. I sponsor volleyball teams. I build personal relations with the leaders in the community. And then later, much later, after we're a partnership, I say, I got this study back at Hopkins. And if you're comfortable, I would like to explain to the community the benefits of the science for this community. And then I may seek volunteers to come do it. But the volunteering is later, after the relationship has been built. I would argue that when it works with record linkage, the same kind of thing happens. The IPUMS team built relationships with Ancestry.com and the Census Bureau over many, many years. It's a two-way relationship. We do things that are helpful to them. And after building trust and working relationships, hey, be nice if we got those data that we can then link to the IPUMS architecture. Beyond that, being creative and flexible in what we want. We may have an idea of how and when and in what form we want data, but we need to be creative and flexible because our partners don't always see it that way, and it doesn't always work that way. And then, of course, because this is a time and resource-intensive process, it requires patience and perseverance. This is why I say, for you young people, you will down the road be those who are bringing in new linked data because it's going to take you years to build those relationships, and we're going to be gone. So the data nirvana, how do we get there? Just to summarize, be imaginative, rethink, and encourage your colleagues to rethink what is possible in science with the kinds of data that we use. The papers that we heard this morning that we're going to hear this afternoon are great examples. Many people in our research communities would not have thought many of those papers were possible because they don't understand what's possible with linked data. Persevere or preserve and archive the data in all its forms. Go, be energetic, link. But imagine what's possible and go thoughtfully by engaging in partnerships, not in extraction. Walk the walk of data security. Every data breach that researchers are responsible for is costing all the other researchers unknown amounts of trust and access. Be patient, this takes forever, and be compassionate with the people or the individuals or the organizations that you're seeking data from. That's what I got.